You're welcome back to Breakfast Extra. Today's actually a very interesting day because we're still dissecting health matters, and our sexual health is where we're going, where that remains one of the most important but often overlooked aspects of public health. Across the world and increasingly in Nigeria, sexually transmitted infections are rising, particularly among young people. It shocked me. Health advocates say the problem is not only about behavior, but also about the awareness. Many infections go undiagnosed because people are afraid to seek testing or lack access to reliable information about prevention as well as the treatments.
Now, events like STI Awareness Week and also International Condom Day are designed to change that narrative. The goal is simple: encourage open conversation about sexual health, promote safe practices, and reduce the stigma that often surrounds testings and also treatment. To guide us through this conversation, we are joined by Owen Omo-Ojo, CEO of HIGC Health Consultants. Watch it, she has no filter. You're welcome. Good to have you here.
Same here. Good to be back.
It's been a while since you've been on the show, unless I wasn't here the last time you were here.
It has been a while.
I always look forward to having you here.
Same here.
Let's talk about it.
Thank you. Thank you.
Let's talk about sex. Let's talk about, that's actually...
You know what just came to my mind?
I remember the 1990s.
The song.
Yeah, that was intentional.
Yeah, but I mean, sex is important, so yeah.
Yes.
Let us talk about it.
When it comes to STIs, you can't discuss STIs without sex. What's happening in Nigeria? Because I remember sometime in the early 20s, it was recorded that we're having reduced numbers or records of STIs. And it seems to be going up all over again. What exactly could be responsible, Doctor? Okay,
so thank you very much once again for having me. I think, first of all, there is a gap in reporting. And so reporting is increasing now. And so that could be responsible for why it appears that the numbers are going up. Yes, we do have a high STI burden in Nigeria. One of the highest globally, and of course in sub-Saharan Africa and globally. Of course, we're nowhere near South Africa.
Why did you look at me when you said that?
We're nowhere near.
I told you she had no filters. I warned you before we started. But go on.
We're nowhere near South Africa when it comes to STIs and STDs, like specifically HIV. But we are one of the highest globally, and I think largely what is responsible for that is one, awareness, two, so three pillars: awareness, prevention, and early detection. And when we talk about awareness, it's important to tie in stigma, right? Because that's largely why a lot of people are not getting tested, right? So awareness, prevention, and early detection, those are the three pillars that I would say.
I'd like to say culture as well, because in our culture, we don't talk about sex, we don't talk about safe sex.
Unfortunately, in our culture, sex education is viewed more as a moral issue as opposed to a healthcare issue. And so from a public health perspective, it's important to emphasize that sexual health is a health care concern, right? It falls under the umbrella of healthcare. And the more we continue to dissuade people from viewing sex, which is it's a normal human occurrence, right? The more we dissuade people from looking at sex or sexual health as a moral issue and tilt towards looking at it more as a healthcare issue, because good sexual health is integral to overall health and well-being, then I think we can make some good strides in reducing the burden of STIs.
Our South African representative has a question.
Could it be that, especially in Africa, when we speak about the culture and the conditioning as well, that one of the reasons why you find the reporting, I know that you said the reporting is a little bit higher now, and I think it's because of the generation that we're in, but could it be that in Africa, generally, sex or intercourse is something that's supposed to be done when people are married, and you find in situations that many people are engaging in this activity outside of marriage? So could it be that people are afraid to report it because they would be judged in clinics and in the homes that they are practicing coitus?
Yeah, coitus. Yes, oh, definitely. I think in the context that we're speaking in, so in Nigeria and in Africa generally, we have to take into cognizance the social, cultural, religious dimensions of it. And that's why I mentioned earlier that it's often looked at as a moral issue, right, as opposed to a healthcare issue. And so, yes, our culture does preach or push for people to be married before they engage in sexual intercourse. But we must be realistic and understand that many young adults are sexually active, so we can't play ostrich and bury our heads in the sand and act like it's not happening. It is happening, and so what can we do is to get ahead of it and ensure that we're providing young adults and adults in general with the tools that they need to prevent STIs. And that's why I'm very specific on the 3 pillars of awareness, prevention, and early testing. And so we need to be talking to young adults. We need to be preaching the need for early testing. We need to be preaching the need. Yes, when we're talking about prevention, the only proof or the foolproof 100% way to prevent STIs is abstinence. Yes. And so I think that somewhat ties back into why in this context we preach about, you know, abstinence before marriage and things like that, because obviously when you abstain, then you don't get, yes, you protect yourself essentially. But again, abstinence cannot be the only way. So for consenting adults who want to engage in sexual intercourse before marriage, they need to understand what are the things that they need to do to prevent STIs and ensure that they're safe and maintaining good sexual health.
Now that you said that, what does data show when it comes to the numbers of people who are infected with STIs in Nigeria? Are these young adults, mid-aged adults, or older adults? Where is it? Because that's a factor to helping the situation, isn't it?
Absolutely. So in Nigeria, the age range for people who are more at risk of getting STIs or getting infected with STIs are young adults between the ages of 15 to 24. And I know it's surprising that at the age of 15, but then again, we do have teenagers that are becoming sexually active at a young age, so between 15 to 24. But then, of course, it's still quite common in older people as well. So they're more at risk.
16 to 24, though. 15
to 24. 15 to 24.
Is there further data that shows whether it's mostly what gender it is?
Well, mostly male, but then I mean it's pretty much on par. It's pretty much on par. And globally, according to the World Health Organization, every single day there's at least 1 million new STI infection every single day globally, right? And 374 million new STI infections are happening annually globally. 374 million. 374 million. Like, just think about that. That every year globally there are 374 million at least new STI infections. And unfortunately, a lot of these are from curable STIs, right? So amongst these are gonorrhea, chlamydia, syphilis, trichomoniasis, you know, and those are curable STIs. Unfortunately, people are not getting tested on time, and we always say that prevention is better than cure. And when you delay testing, then it leads to STDs, so like the disease part of it, and other complications, so things like male and female infertility and certain cancers as well. And so I cannot overemphasize the importance of prevention and early testing.
But what about the authorities? What about government? What about the states? Are they doing anything in particular to help the situation?
I think largely I would say One of the major barriers, so I'll say two of the major barriers to early testing is one, we already talked about stigma, right? And the stigma, unfortunately, doesn't only come from society, it also comes from healthcare professionals. And the second thing is access to these services, because we know that healthcare increasingly is becoming a luxury commodity, so to speak, because people are prioritizing food and shelter over healthcare,
or
right?
alternative medicine,
which is not all in itself bad. I think it's just about improving investments in research. In research for alternative medicine. And so the government, I mean, there are government facilities where people can go to get tested, and the frequency is, it's advised at least once a year for adults who are sexually active and who have multiple partners. But it's also important to emphasize that it is responsible sexual behavior is important. Avoid having multiple sex partners, and encourage having open conversations with your sexual partner about getting tested before having unprotected sex, right? So getting tested, and luckily we do have test kits now that are available, you know, that you can actually do the test yourself. Okay. Yes, oh yeah, that you can buy at the pharmacy if you don't want, for whatever reason, you don't want to visit a healthcare facility.
Why wouldn't I want to visit the healthcare facility?
Well, remember I talked about stigma. So, and it also comes from healthcare professionals.
Yes.
A friend of mine was telling me a story recently. He was at a pharmacy, and a young, they were probably about 19, 20 couple, they walked into the pharmacy and they wanted to buy condoms. And he said the way, you know, there's a way you can judge someone with your eyes.
Yeah.
Not actually saying anything, right? And he said the way the pharmacist looked at them and judged them, like it was
kids.
Yeah. Do you understand? And even the interaction was just so cringe. And after they left, after they walked out, I think my friend said he bought. He eventually paid for the condoms, and after they walked out, my friend had to speak with the pharmacist and say, "You don't do that. You don't do that. What you're doing is responsible."
For why they don't come and get the necessary.
Exactly. So it's important that we take away stigma, right, and encourage people who are seeking you know, responsible ways to prevent STIs. You know, it's important that we encourage them and we don't stigmatize them. That's really, really important. So, yeah.
Very interesting. But I'm hoping how this little forum that we have here is going to help anybody that's listening. Yes, we're advocating that there be less stigma and that people pay attention to their sexual health with habits, by change of habits and all. But for anybody who absolutely needs more information about STIs, where can they go? Is there any secure, safe place? And I do mean safe place very intentionally, that people can go to get information or give information about what's happening to them or a community.
Okay, so again, thanks to News Central TV, because this is an amazing platform to create the awareness, which is one of the critical pillars for preventing STIs or reducing the burden of STIs, right? So this is a great platform. There are also resources that can be gotten on the WHO website and across public health consulting firms as well, so like HIGC Health Consultants. We do a lot of public health advocacy and things like that, and so you can go to our social media handles for that. And this is not advertisement, Mazino. I do not like the way you're looking at me, but I am.
No, we don't judge people like you judge people. So.
You know, so there's a lot of awareness there out there. So World Health Organization, UNAIDS as well on their social media platforms, and of course on their website as well. And then of course your primary healthcare centers, that's like the closest point of access to care for
any community.
For at the community level. Community health pharmacies as well, so the retail pharmacies, they are also an important part of the value chain that help with health promotion as well, because we're always preaching from a public health perspective, we're always preaching about prevention, and so those are places that they can go to for access to healthcare. And luckily with AI now, we have a lot of telemedicine platforms. And AI telemedicine platforms as well, that you can actually go and get verified information and not relying necessarily on Dr. Google, right, to get some of those things, because again, there are so many myths out there, right? And unfortunately, like Dr. Google now, like can just you have a rash on your genital, and you go to Dr. Google and it gives you like a million, and you're already panicking, and that fear inhibits you from actually going to get tested. And so that's why I don't have anything against Dr. Google. I just think that we need to be responsible about it. So
Dr. Omo-Ojo, I want to say thank you very much for joining us today. We had your father on last week.
Really?
Yes, he was.
He didn't tell me.
Yeah, well,
Oh.
yeah.
Okay.
Busy family.
A very busy family indeed.
Family.
Thank you very much
Yes,
for being
thank
with
you
us
so
for our
much
final
for
segment.
having
You get
me.
to sit.